Most likely, everyone in this room has heard the phrase, end the mental health stigma. But what does it really mean? It's a phrase full of broad terms that we need to unpack. First of all, what is a stigma? The dictionary definition of a stigma is the perception that a certain attribute makes a person unacceptably different from others. Now, mental health and mental illness, mental disorders and mental illness are two phrases that have been heavily debated in the medical community because there are so many mental illnesses and disorders that it's hard to categorize them specifically. But some of the main categories are substance abuse, mood, anxiety, personality, psychotic, and eating and trauma-related disorders. So end the mental health stigma. What does it really mean? It means to stop the judgment and mistreatment of people because of their mental illnesses or disorders. 43.8 million Americans suffer with mental health and mental illness annually, and 25% of the worldwide population will suffer from a mental illness or disorder at some point in their lives. Now, 1 in 5 of these people will not get the professional medical care that they deserve and need. So why is that? The main reported reason that people don't get the care that they need is because of the fear of being judged. When I was 3 years old, I was diagnosed with selective mutism. Essentially, that meant that for the first 5 to 6 years of my life, I didn't speak to anyone except for my parents and a few selected, trusted adults. Selective mutism is a childhood anxiety disorder that affects less than 1% of children. Now, when I was in kindergarten, I didn't speak to anyone except for one of my teachers occasionally, and never in front of anyone else. Kids thought that I couldn't talk and would ask me if I could, and I wanted to tell them that I could talk, and I wanted to make friends, but I couldn't. Selective mutism can, if treated correctly, can go away, but for the unlucky majority, it turns into a severe social anxiety disorder that can last throughout your whole life. Now, this condition still affects me today, but I have been getting better. I received treatment that has helped me become much better than when I was younger, and able and willing to talk to all of you about what I've gone through. And one of the main reasons that I've been able to get better is my amazing support system of people. Having a support system is one of the main ways to combat stigma and to help people suffering from mental disorders get better. These amazing people and so many more have gotten me to the place that I am. But I've been afraid my whole life. I lied about what I was feeling, and I bottled up my emotions until I was alone so that people wouldn't think I was weird or judge me for what I was going through. And I know that all the people around me wouldn't, but that's not what my brain told me. Now, recovery is never a straight line, and I have my ups and downs, but I've become the person that I am today because of all of these people and because I've been able to overcome this stigma. Now, but this isn't just about me. It's about the millions of people suffering from mental illnesses. It's about the people that don't understand the dangers of stigma, and it's about the people that aren't able to receive the treatment that they need and deserve. One of the main reasons that people aren't able to actually get the care that they need is the limited access. The Mental Health Parity and Equity Act requires that there be an equal amount of coverage between mental and physical illnesses, but that's not always what actually happens. Now, 77% of organizations state that they have mental health assistant available in their clinics, but that they aren't at equal value of their physical health benefits, and people don't know about them necessarily. People don't know about them, or they can't pay for them. Insurance companies are known to not cover mental health and mental illness care as much as they are to cover physical illness care. Another main factor that leads to this dangerous stigmatization is the dangerous stereotypes in the media. On one end, there's the shy kid which romanticizes what anxiety disorders are really like. Kids with anxiety are seen as just shy and antisocial, where that's not normally true. A lot of kids suffering from anxiety want to talk to people and want to be included in groups, but won't reach out to anyone. And so they aren't included. They aren't given the chance because they won't make that step. And that's not always something they can control. And on the other hand, there's the dangerous and psychotic killer type that's portrayed in media that creates the false truth that all people suffering from mental illness are crazy and dangerous. These stereotypes and many more make identifying mental disorders in people around you and in yourself hard, because if you see these false stories, you don't actually understand what mental illness actually is. And people don't understand that what they're going through isn't necessarily normal and that they can get better. Now, it's important to end this stigma because it can be debilitating for people. It can make it impossible for them to seek out the care that they need and impossible for them to get better in the way that I have been this for the past few years. The main way to stop this stigma and for people to get the care that they need is to stray away from these dangerous stereotypes, to provide the proper care and access to medical help that people need, and to be open to talk about how you're feeling and how others are feeling with each other. Thank you.